pretty much did a script that's going off of the MI case that we already went over in class. Kyle is the dad, Tina is the mom, Tammy's the daughter, and Vogel is the doctor. And I'm just the narrator that's gonna kind of pull away from the story a little bit to explain to you guys a little further what we're doing. That's a lot of lines to have to give Vogel if he explained it all by himself. So you guys all know that he had a cardiac episode over Thanksgiving, and then he has had multiple stress tests, and the first one didn't come back good, and then he had an angiogram with an 80% blockage and only 45% output. He has a family history of cardiac episodes. Both of his parents had heart attacks in their 60s. So now we're in the doctor's office and we're going over what our option is, and the main option that we're focusing on is CABG.
Good afternoon, Smith's family. I understand we're here to further discuss the decision to undergo coronary artery bypass grafting, or CABG.
Yes, and we have a few questions about the procedure.
I want you to understand what we will be doing for Kyle, so if you have any questions, please feel free to ask them. After the significant findings after his stress test and lab tests, I feel the best course of action, of course, is CABG.
What exactly is CABG and what does it do?
Plaque is building up in Kyle's coronary artery and has already caused an 80% blockage. This blockage, the flow of oxygen-rich blood to his heart, which could ultimately lead to a heart attack. CABG is pretty much how it sounds. It's a surgical procedure that bypasses the blockage and allows the oxygen-rich blood to continue to flow to his heart muscle. We graft a blood vessel from another part of the body, usually the leg, sometimes the arm. We then place this attachment above and below the blockage to continue the blood flow.
Okay, so he really touched on what CABG is. It's pretty much what it sounds like. It's bypassing the blockage that's in the coronary artery. So if the artery, if it was blocked right here, they would take the saphenous vein, so you would have an incision in your leg, and also this is a pretty extensive surgery. They cut open your chest and then they separate the breastbone. But after they get the blood vessel that they're going to use for it, they pretty much attach it above and below where the blockage is, so that the blood can just flow around where the blockage is, so that they don't have to go in and move anything around. It's just simply attaching it above and below to bypass that.
Is this treatment going to be effective for my father?
I certainly feel that CABG will be an effective treatment for your dad. Given his family history of heart attack, I think it's essential that we be proactive in preventing a heart attack. The outlook is good, Mr. Smith, so as long as you're willing to make changes to your lifestyle changes after the surgery.
So what are some of the side effects of the surgery, and how long will my husband need to recover?
Some of the side effects of the procedure would be some discomfort and itching from the healing incisions, along with some swelling in the areas that were grafted, and a muscle pain or tightness in your shoulders, muscle, and the back.
Okay, so also with the recovery thing, it's usually they spend a day or so in ICU so that they can watch him and make sure that nothing is happening, nothing is coming up, and that his vital signs are starting to stabilize and he's okay. After he is stabilized, they would move him from the ICU into a post-surgical unit at the hospital. And there he would stay probably 4 to 7 days is what the timeline got for all of our sources that we looked at. It was all between 4 and 7 days. But the actual recovery time for it, it could take 6 to 12 weeks for a full recovery from a CABG surgery.
Look, I understand that CABG is the best option for me, but how will this affect my checkbook? Is this something I can even afford?
The exact cause of CABG is something that I'm not too sure of. I don't want to give you an estimate that's inaccurate, so I have the billing department ready and prepared to give you a cost estimate for you. Of course, your insurance will cover a portion of the surgery, so if you're worried about that, you could call them and they would cover the contact before that.
So how long will I be in recovery?
Typically, recovery at the hospital is 4 to 7 days, and depending on how your heart responds to the graft. Total recovery can, however, take from 6 to 12 weeks, but patients typically resume work after about 6 weeks, pending restrictions, of course.
Like we said, it's a pretty big surgery. It opens your chest, so once he's back at work, roughly 6 weeks after the surgery, there's still some restrictions, like as much as you can pick up. It's only like 10 pounds that they allow for you to pick up for quite a few weeks after the surgery, and then there's still gonna be some discomfort and some pain at the site. That's pretty normal with a big surgery like this. So, yeah, that's CABG.